أهلا بكم في تلفزيون كارديو أليكس.
And with us, Dr. Mohamed Shenasa, professor in cardiology from USA. Hello, doctor. How are you?
Hello,
Welcome.
good. Thank you.
What do you think about CardioAlex 2017, and is it meeting your expectation?
Yes, this is my 10 or 11 times I'm attending the CardioAlex. That's the only meeting that I go every year, more than other meetings. And every year, honestly, the CardioAlex is getting better and better and bigger. So the faculty is excellent. The topics that are discussed very up to date, and it's actually beyond my expectations for this meeting.
Okay. What are you going to present this year?
Yeah, this year I will present on the devices that are used for patients with heart failure. Patients with heart failure have a lot of arrhythmias or rhythm problems, including what we call it a left bundle branch block, and there are guidelines to implant those devices. It is called CRT, cardiac resynchronization therapy. These devices are designed to improve the function of the heart in those patients who are suffering from heart failure of any cause, mostly coronary artery disease, or many of them are non-coronary artery disease. The device has been very successful and is actually lowers the mortality. It lowers the hospital admission and lowers the arrhythmias. So that's a big breakthrough that I will be discussing this year.
Okay, this is new, right?
New
project?
It's relatively new. This is being around for more than 10-15 years, and now it's in clinical practice, but we are learning more and more according to the guidelines. These devices has been very useful to lower the hospitalization and improve survival of the patients.
Oh.
That's fantastic.
Okay. What are the predictions of non-response in CRT patients?
Yes, it's a very interesting question that you have. It's about 25 to 30% of the patients who undergo CRT or cardiac resynchronization therapy to improve the cardiac function, they do not respond. As of today, we do not have a really good risk prediction that who will respond, who will not respond. In general, the female patient respond better, the younger patient respond better. Those who are what we call them non-coronary artery disease, who do not have coronary artery disease, but their pump function has been decreased, are responding better. The patients who have obesity, who have a kidney disease, are responding less favorably. But still, we are working, and there are trials going on to find the non-responders.
Okay. When do you use novel anticoagulants?
Repeat, say that again.
When do you use novel anticoagulants?
Oh, yes. Currently, the novel or new anticoagulants are used in place of warfarin, which has been around for more than 40-50 years. Any new patients who have no contraindication, we start them on novel anticoagulants. The patients who are already on warfarin and doing well and they are happy with it, we leave them alone. But any new patients, we try to put them on novel anticoagulants. There are two groups of patients who we are not using them. One is the patients with valvular heart disease, especially mitral valve disease, and the other one is patients with mechanical valves. There are still questions whether the novel anticoagulants are safe or not. Besides these two groups, severe mitral valve disease as well as mechanical valves, the other valvular heart disease and other conditions, especially atrial fibrillation and stroke prevention, are the best indications for novel anticoagulants.
Okay, well, what would you like to see next year in CardioAlex?
Next year, I've already promised to attend. We will have a better program than this year. We will have the results of some of the new trials, the results of some of the new devices. like leadless pacemakers, like subcutaneous implantable cardioverter defibrillators, and more studies and more trials regarding the ablation of atrial fibrillation, which is a big problem, and also ablation of ventricular arrhythmias.
Okay. At the end, we would like you to say a word to the people all around the world to come to visit Egypt and that Egypt is safe. How did you find Egypt?
Actually, Egypt is one of my favorite countries to visit. My colleagues in Alexandria and Cairo, they call me that I am half Egyptian because I have been coming to Egypt every year for the last 15 years, either in Cairo or in Alexandria. So it's very safe. Alexandria is called the Pearl of the Mediterranean, and the timing is very pleasant, so I will encourage my colleagues to attend.
Okay. Thanks a lot, doctor.
You're welcome.
Thank you.
We hope that you enjoy and see you next year. Bye-bye.